Hello everyone, welcome back to my YouTube channel. If you're new to my channel, make sure you hit subscribe button and let me know in the comment section what are your questions and what do you want to talk about next. If you're here, you probably have heard of pelvic floor muscles or pelvic floor physiotherapy, but you're not sure about what these muscles are, what they do, and what is done during a pelvic floor physiotherapy session. So I'm here to answer all of these questions. So pelvic floor muscles are a basket of muscles that cover the bottom of the bony pelvis. We have 3 layers of these muscles, all of which are connected all the way from your tailbone to your pubic bone and from sit bone to sit bone. This is the very first layer, the outermost layer of the pelvic floor you're looking at. Each layer has its own individual function, but all the layers work as a unit to provide support for the pelvic region and the joints of the pelvis, including the pubic symphysis towards the front and the sacroiliac joints towards the back. In a way, these muscles help with the posture and stability of all the other joints around the pelvic region and the whole body. If you look at the pelvis, everything stacks on top of the pelvis, including your rib cage, your entire spine, your skull, and our lower limbs attached to the pelvis. So this is the bony block. This is the foundation of the body. Through stability of the pelvis, we can have a better posture and we can move without actually causing the load going towards a specific part of the body and causing issues in the body, including hip pain or lower back pain, or all the way issues to the jaw or the neck or shoulders, or all the way issues down to the foot. So the muscles of the first layer that you're looking at right now are responsible for arousal and orgasm. These muscles are attached to the fascia of the clitoris and they help clitoris do its job, which is pleasure. I'm going to talk about that in more detail in a different video. The second layer is pretty much exactly like the first layer. It pretty much mirrors the first layer and it sits in the middle. That's the layer that goes around the urethra, the tube that carries the urine out, and sphincters of the anus. That's the layer that keeps you continent. It has a reflex response. Anytime you sneeze or cough or laugh, these muscles reflexively contract and prevent you from leaking. But they also give you control over your bladder and bowel. If you want to hold it in, you can use these muscles to hold your bowel or hold a pee inside, and when you are ready to go, you just relax and everything should just flow out of your body without the need to push or strain. Now let's talk about the third layer. The third layer is the deepest most layer of the pelvic floor muscles and where the organs of the pelvis sit on top of. We have the bladder sitting towards the front. We have the uterus, fallopian tubes, ovaries. And if I remove the uterus, you can see the vaginal canal that sits in between the bladder and the rectum in the back. It's the job of the pelvic floor muscles to keep the organs in the right place, to support them. The muscles also provide you with that tone around the vaginal entrance. The tone should be enough when you feel something going in or coming out, let's say with insertion of a tampon, with a menstrual cup, during a medical examinations or during intercourse, but the tone shouldn't be so high for you to feel pain or discomfort with any of these activities. These muscles also have a sump pump action, which means that they help a lot with circulation of blood and lymphatic flow in the region, which is very, very important to make sure that waste goes out of the pelvic region and the nutrition can come in with the blood flow. If your pelvic floor muscles are not working as optimally as they should, you will have signs of pelvic floor muscle dysfunction. And it can be something like leakage of urine whenever you sneeze or cough or laugh, or even having a hard time initiating the flow of urine, needing to strain or push to allow the urine to come through the urethra, or having a hard time with bowel movements, getting constipated, having a lot of bloating, having gas trapped inside that you're not able to release. If you're having a hard time with medical examinations, going for a pap smear, you're not able to insert a tampon or menstrual cup in, and intercourse is painful, these are all the signs that is guiding you to go see a pelvic floor physiotherapist as soon as possible. So now what happens in a typical pelvic floor physiotherapy session, and what do we do when you come into a session with a concern regarding your pelvic floor? One of the main things that we have to do is to talk to you quite a lot about your symptoms. How is it impacting you? How is it impacting your life? How has it changed the way that you are moving, the way that you're carrying yourself? And what are the other symptoms that you may not think as relevant to what your primary concern is, but it could actually be very relevant? We're going to need to talk to you about what these muscles are, what they do, what is the root cause of your symptoms, and what is causing these symptoms that you're having, what lifestyle changes that you need to make that is going to make everything better, even starting from the session onwards. The other things that we need to do physically, we have to check you from head to toe. We're going to need to look at your posture, your movement, as well as areas that you may not think is relevant to the pelvic floor and signs of pelvic floor dysfunction, but areas that actually are directly impacting the function of the pelvic floor, including your jaw, your feet, your hips, your lower back, as well as also the function and the behavior of your nervous system, to understand how we can get you from the point that you are to the point that you want to be. So contrary to most people believe, we don't actually have to just zoom into the pelvis and understand what is going on with the pelvic floor muscles to actually resolve your symptoms. We have to take a step back and look at your body as a whole, because everything works together, everything impacts each other, and understand what else could be causing your symptoms, what else is going on that you may not think is relevant that we need to also address to make sure that you get to the point that you want to get. So now, how do we assess your pelvic floor muscles as pelvic floor physiotherapists? We do have quite a lot of approaches depending on what your concerns are, depending on which approach you're more comfortable with, how much information we can get through a specific approach, what are the goals, and we can always talk to you about all of these approaches, what are the risks associated with some of them, and what of maybe the downside of some of them. If you're not able to get the information that we want to, if you have a question or concern that relies on a very specific type of assessment, we will need to discuss that and understand what is the other option to make sure that you can get the best out of a session. Because of the anatomical location of the pelvic floor, one of the most comprehensive ways of assessing these muscles is through an internal exam. But that is not the only option. If someone is not comfortable with an internal exam, or maybe you're not immediately comfortable with an internal exam, you may want to try different approaches and see where that leads you. We can always talk to you about different approaches, including external examination with palpation or touching around the region, or even external examination starting by just examining over the clothes, or using biofeedback, which I can again explain in a different video. But through even an internal exam, which is explained thoroughly before it's done and also thoroughly throughout the exam, what I want you to know is that it's unlike any pelvic exam you've ever had in your life. It's maybe the most gentle exam you've ever had in this region done by a practitioner, because we are actually having a different approach, maybe from a medical practitioner. So it's not like a gynecological exam, it's not like a pap smear. We are looking for areas of dysfunction, and we're very gentle in the way that we are doing it. So you will be very comfortable throughout the examination. But if you're uncomfortable with an approach, you can always, again, have a conversation with your practitioner, be open about it, and say, maybe this is not the approach I want to start with. I have patients that maybe even start with a different approach, and when we gradually lead to a different approach as per their comfort. So this is something that you can have open communication with your practitioner, decide what is the best option for you as you want to move towards your goal. So the bottom line is that your practitioner is always right by your side, holding your hand and taking you step by step towards your goal, always requiring open communication, checking in with you to see if something is working or is not working. So I would say is one of the most intimate and rewarding type of practices I personally ever practiced. I practice orthopedic, I practice neuro, and pelvic is, I would say, by far the most rewarding form of practice I personally, clinically have had throughout my clinical practice years. Make sure that you try finding a practitioner that you can connect with, that you can trust, and that you can have open communication with, because again, it's a very intimate type of practice. You want to be comfortable when you go in for a session.